Hello, everybody, and welcome to our Singing After Vocal Injury webinar. My name is Alida Annicchiarico, and I'm a vocal coach here in Vancouver, BC, Canada. And I am joined by my colleague, Sherri Zelazny from the Surrey Voice Clinic.
Good morning.
Welcome, Sherri.
Thanks. Good morning.
So we are going to talk a little bit about singing after vocal injury today. This is a topic I'm really passionate about because many of my clients have come from vocal injury and have been cleared to sing again. And I know, Sherri, that you have worked with many singers over the years. And so I thought we could put our information together and get the word out there and start a conversation about something that's really important.
Sounds good.
Okay, so let's get started here. First of all, here's our information. If you guys have questions outside of the presentation that we're presenting today, please feel free to reach out. You can reach us by email on our websites or even on Instagram at Surrey Voice Clinic or at Alida Vocal Studio. So I thought we would start with a nice quote from my favorite tenor. The voice collects and translates your bad physical health, your emotional worries, and your personal troubles. So when anything's going on in the body, the first thing to be affected sometimes is the voice. Am I right, Sherri?
Absolutely. It's often an indicator that we look at for other problems.
So let's talk a little bit about voice disorders, and I'm going to hand over the mic to Sherri to dig into the scientific aspects of voice disorders.
All right, thank you. Go ahead, Nick. Yeah. So we talked a little bit about this in our first webinar about voice disorders and assessment of voice disorders, but let's just review a little bit about how we identify a voice disorder. So we can look at it in two ways that can occur individually or together. One is changes in vocal quality. So if you feel hoarseness or roughness or your pitch changes, those are changes in vocal quality. You may also experience, together with changes in vocal quality or by itself, a change in vocal effort. So vocal effort, identifying vocal effort is about thinking about vocal fatigue. Do you get tired talking? Is it taking more effort to communicate? Maybe the quality of your voice has also changed, but maybe the quality is okay, but you feel like it is just getting more difficult to keep your voice going throughout the day. And the bottom line is any changes in your voice that interfere with your life, it can be considered a voice disorder. So it's not the same for everybody. A lot of identifying a voice disorder depends on what you're using your voice for and at what level of performance or education you're at with your voice. It really depends on what you're using your voice for. Everybody is different, but the bottom line is if something about your voice has changed related to quality or effort and it is interfering with what you need your voice for, that can be considered a voice disorder and deserves evaluation. Here are some signs and symptoms of voice disorders, things you might want to pay attention to. Roughness, of course, or quality changes, breathiness, strained quality, strangled quality to your voice, abnormal pitch, abnormal loudness. This pitch and loudness can refer to a pitch that is too high or low, and same with volume. If you feel like your voice is getting louder and it's hard to be quieter, that might be something that has changed. Resonance here, when we're talking about voice disorders, we're talking about nasality, hypernasal, too much resonant, too much air out your nose, or hyponasal, which is how we sound when we have a cold and we're all congested. A little bit different from the resonance that we work on in voice therapy. Aphonia is a word for loss of voice, so if you've absolutely lost your voice, obviously that would support a need for evaluation. Voice breaks are when you're talking along and your voice cuts out but then comes back. Weakness to voice, a gurgly, wet sound to your voice might mean there's some secretions in your airway. Hoarseness, roughness, of course, are just words that we use to talk about quality changes. And then glottal fry, which is kind of a buzzword around the voice world. Glottal fry does not have to be a voice disorder, but if you have never spoken in fry and now you're noticing kind of a crackly, poppy sound to your voice, that could be a sign of a voice disorder and mean you're having a change to your vocal quality.
Okay. Here's some more disorder signs.
Yeah, these are just adding some things in here because really any changes that you experience to your voice could be defined in many different ways. One thing that I do like people to understand though, like you said at the beginning, Alida, voice is very often a representation of how we're feeling and can be the first sign of some other type of disorder. For example, progressive neurological disorders such as Parkinson's, multiple sclerosis, ALS, those often will show their first signs with a voice disorder. So with our voice changes, and we just really, really want people to understand the importance of voice changes and pursuing evaluation if you're experiencing that.
Great. So here is the most interesting slide I find.
Here we have the smorgasbord of voice problems, benign voice problems, and we just thought we'd share this with you as these are some common diagnoses and common terminology that we hear when we're talking about voice problems and when singers and professional voice users go into the ear, nose, and throat physician or speech pathologist. These are just some pictures to help you understand what the words mean. So in this, you can see some very small bumps right here and here. These are vocal fold nodules. And I just want to say also that whatever you think that all this might look like, nothing is terrible and nothing is unmanageable. Nodules by definition are two, bilateral, symmetric at the anterior 2/3 junction of the vocal folds right here. Here we see two different examples of a vocal fold hemorrhage, and that's when blood vessels burst into the muscle, just like a bruise. Vocal fold hemorrhage is one of the only times that we actually recommend voice rest. If you have a hemorrhage, you need to let that hemorrhage heal before using your voice again. Usually about 3 to 7 days will do the trick, but this needs to be identified. And a hemorrhage is another super important reason why the vocal folds need to be looked at before any kind of voice treatment is offered, because a hemorrhage absolutely needs voice rest. This is something called a pseudocyst. It's a little pouching out of the middle layer of the vocal fold. Again, perfectly manageable with some voice therapy. This is what we call a hemorrhagic polyp. You can see this little, again, a pouching out of the middle layer of the vocal fold, and that has some blood in it, just means the vessel has burst. Sometimes, more often than not, these might be taken to the operating room, but I can tell you that we have had some very nice success getting rid of hemorrhagic polyps with voice therapy. Another super important reason for a proper diagnosis and meeting with a speech-language pathologist prior to considering an operating room visit. This is a vocal fold cyst. This is a little bit more along the lines of something that might need surgery. You can see this very well-defined kind of encapsulated lesion in the vocal fold. This is a vocal fold granuloma. This is on the cartilaginous vocal fold, and we don't have to go a lot into anatomy and physiology right now, but this is in the back. This is can be caused from reflux if you get a little tissue irritation of the tissue from from reflux, and then you keep kind of rubbing it together, something like a granuloma can form. These can also be the result of intubation damage from the surgery. These can absolutely be healed with behavioral management. Sometimes they need a little bit of help from the physician or possibly the operating room, but like anything, it would be best to get rid of all this with behavioral management, voice therapy, to avoid an operating room visit. This is something we call infraglottic edema. This is often very common with reflux issues. You can see that you see an edge here. That is the edge of the vocal fold, and then you see another kind of edge below it. The edge below is some swelling or edema below the vocal fold. Again, very common with reflux, as is this picture right here. You can see all this redness, dark redness and kind of thickening in the back. That is some reflux tissue changes. This right here is where the esophagus opens. So if you're having some reflux, some acid come up and out of your esophagus, it will sit right around the back of the vocal folds and contribute to these tissue irritation issues. These I like to show people, these are called bamboo nodules. You can see the little bump in each vocal fold that makes the vocal fold look a little bit like a stalk of bamboo. These are very typical and often help us with a differential diagnosis of autoimmune disease, because that is the only time somebody might have a bamboo nodule. These are very, very rare, but we have seen them and always associated with autoimmune disease, such as rheumatoid arthritis, Sjogren's disease, lupus. If you have autoimmune disease, it does not mean you will have bamboo nodules, but I do like to show these sometimes because of how typical it is of autoimmune. This down here is what we call a non-hemorrhagic polyp. So you've got the hemorrhagic polyp up here that's got some blood in it. This is a non-hemorrhagic polyp. I can tell you that this particular individual is a singer-performer. He sings in a band, he plays the drums. Prior to coming in, he was losing his voice in every performance and after every performance. But since he came in and got some voice exercises, he actually is on the road making money, singing, playing the drums. He has not lost his voice again. So that's a really nice demonstration of how you can perform and be on the road and make money in the presence of a lesion, as long as you've got a good team behind you and you've got some good vocal hygiene and you know how to work with your instrument in the presence of a lesion. We can have some super success on the road. So quick blow through some lesions there.
Yeah, that was great. It's exciting to see to actually see what it looks like. Mm-hmm. Yeah.
Yeah, and again, I know that, Alida, you're going to talk about this. We would just really, one of our goals is to help people understand the importance of getting evaluated, the importance of identifying problems, and the importance of getting the right treatment so that you can get back on stage, and not to be fearful about these things if you've got the right team in place, for sure. So again, what we really want to stress is the importance of early identification of voice problems. Don't suffer through your voice problems. Let's get things identified. Let's get you the right exercises and the right techniques so that everybody can move forward and be successful. So early identification. If you think something is changing in your voice, you know your voice the best. Let's get you to the right place and get the right support to move forward.
Great. So thank you so much, Sherri, for giving us a little bit of insight there. We did a webinar a few months back that was just on vocal health, and we are going to be having those on our website as well. And I'm just doing a website upgrade right now, as I know you are. So, and that one was more of a comprehensive dig into the injuries and to also the examinations, the evaluations, and the different instruments that you use. So I think that webinar was awesome, and it's definitely something to look at if you'd like to go a little bit more in depth. So I'm going to take over here and talk a little bit about singing after injury. I've been a vocal coach for about 10 years now, and I have worked with many clients who have experienced vocal injury and are cleared to sing again. And I feel like there should be some set goals for injured singers. And so I've kind of sort of gotten it down to 6 goals. The most important one is to get clearance from someone in the medical field before resuming lessons. So think of it as like a sports physical for an athlete. You want a baseline evaluation. You want to make sure you know where your voice is at before you start training again. I think it's essential to have voice therapy with a voice therapist on an ongoing basis, because this will help contribute to better speaking habits. And singing really is an extension of speech. So if you are speaking healthily throughout the day, chances are you're going to be singing a lot better. Singing lessons, obviously, to help improve your vocal technique, and to look at ways in which you can get rid of some habits that might be kind of inhibiting your ability to have balance in your performances. Practicing good vocal hygiene, so hydration, rest, vocal exercises, all of that should be part of your regime. And then vocalizing daily, so doing your vocal exercises, and we're going to get a little bit into that later. But I think the most important thing is rebuilding your vocal confidence, because a lot of injured singers, their confidence goes down, and very often there's a stigma associated with vocal injury. We're going to talk a little bit about that in a second. So those are some goals, and I think, Sherri, you mentioned this earlier, but I really think the most important thing is to build a team. It can't just be your singing teacher, and it can't just be your ENT. It's got to be a team of people that you can work with to help get your confidence up and to help get your instrument working better. So your primary care physician, a laryngologist or ENT should be at the top of your list. An SLP, preferably one that specializes in the voice, a vocal coach and singing instructor. Also looking at physiotherapy and massage therapy. I know, Sherri, that you have someone locally that you've recommended to people.
Yeah, here in Metro Vancouver, we have Fred Samarodin at Integrative Physio, and I have met with him recently. He's quite experienced in manual physical therapy and spends a lot of time, and he has lots of knowledge about the head, neck, jaw, TMJ. So in this area, we have Fred who has a lot of experience there. And just to emphasize or reiterate, I guess, is that the whole body is the instrument. So you really can't separate your voice and your larynx from other things that are going on in your body. Even legs, hips, knees, those will play a role in the tension balance in your body. So super important to attend to.
I love that you say that the whole body is the instrument, because part of the whole body is our brain too. And sure. I really think it's essential to have a counselor or a coach, someone that can support you emotionally to get back into the game. And then, of course, a support network of colleagues, friends, family, industry professionals, people that you can connect with. And definitely other singers. Sometimes singers hide the fact that they've had an injury, but and there is a podcast that I forgot the name of the singer that you had sent to me recently.
Cassie, I can't remember her name right now. She was Elsa in Frozen. Cassie.
Right.
Yeah.
And she was diagnosed with an injury about a decade ago, and she was one of the first people to tweet about it. And the moment she did, a whole world of people opened up and said, thank you for talking so openly about it. So she was really courageous in just letting people know. And I think that gave other people the permission to kind of be open about the fact that singers do get injured. It's definitely a thing. just like any athlete would get injured. So I'm going to talk a little bit about why your speaking voice matters. I did mention this before, but how you use your voice throughout the week makes a tremendous difference when you go to sing. So if you are speaking in vocal fry, or if you're speaking very tight and strained, maybe because of habits or maybe because of the injury, it's really important that you get that worked on and that you practice practice speaking with more balance. And that can be helped through voice therapy. And I think I have a slide here on returning to singing. I don't think we need to really panic about singing again, but I do think there's something to be said about proceeding with caution, kind of like understanding like an athlete getting back into the game after an injury. You want to stay very attuned to any changes in the voice quality, and your practice and your lessons and your rehearsals, you should be extra aware of how you're using your voice and the time limit associated with that. Song choices, keys, you might need to consult with your vocal coach on whether or not you can sing in the same key that you had those songs before. Sometimes we like to pitch everything down, and that sometimes isn't necessary. So it's really up to you guys to decide what works best. Definitely maintaining a vocal hygiene, so lots of hydration, rest, and then your exercises are a part of that. I think one of the most important exercises here is the semi-occluded vocal tract exercise. It's a fancy term for basically saying your mouth is half closed, right? And I mean, I did not invent this, but I'm one of the many teachers out there that do use these exercises, singing teachers. And I think there's something to be said about the benefits. First of all, when we use them in a singing capacity, we use a lot of pitch glides. So we don't just stay in the bottom of our voice, but we actually stretch and go up. What this does when we're using the straw technique, basically it's feeding energy back into the folds, so through the back pressure, so you're putting pressure into the straw, and then it's bringing energy back in, and then the vocal folds are able to move with balance, and there's less tension. Did I explain that right, Sherri?
Sounds good. Yep.
Yay. But it works. And I mean, we do this with singing exercises, and it helps the singer achieve balance. So I highly recommend some SOVT exercises, and here are the different types. You can try straw phonation, and there are different diameters of straw. You don't always have to use the coffee stir stick straws, this size here. The smaller diameter, the more back pressure you get. So for some singers, starting in this diameter might be a little bit too small to start. So very often we start them on a bigger diameter straw. And we also do lip trills. So a lot of singing teachers use that. And tongue trills. We also use NGs and Ms. And how we use them is through just ascending scales and descending scales. So not always just working in an upward motion, but actually maybe even coming down. So like, so starting up in the head voice area and coming down. So some really nice little tricks that help us get back into balance. So once you've been cleared to sing again, it's really important to check your vocal technique. And so part of that is vocalizing daily using SOVT work. But the amount of time will vary. So you don't want to overdo it. Some singers jump in and they're like, okay, I've been cleared. I'm going to go back to 2-hour rehearsals. You might need to condense that. You might need to do shorter periods of time. And what we want is to aim for a balance of air and muscle, not just all muscle and not just all air. So it's really important that you get that cleared up in your singing lesson with your teacher. Contrary to popular belief, you don't need a ton of air to sing. You don't need to use a ton of energy. And if you are, sometimes that can contribute to re-injury. And I'm not saying all the time, but sometimes. Vowel consonant combinations will really help. So it's up to you to kind of discuss that with your teacher to figure out which ones will help you according to what's going on for you. Registrating the voice is really important. So understanding that there are 3 different areas of resonance, bottom, middle, and top. And you need to be able to navigate through those bridges and those transitional areas. And how you do that can make a tremendous difference when you go to sing your songs. So singing songs again, whew, that's a tough one because sometimes songs are very challenging. And so you can do your scales and everything's balanced, and then you go to your songs and kind of everything goes out the window. So it's really important that you work on applying those technical aspects to your song phrases. So you might need to adjust the keys, and you might need to maybe hold off on some challenging material. You might need to adjust the set list that you have to, I know one of my clients just the other day decided to put a more challenging song later in the set because he found it to be really difficult to start his set having to sing a high G right off the bat. Even though he was well warmed up, he noticed that it was difficult for him. So, and then looking at how much energy expenditure you have when you are singing your songs. Are you doing an adequate warm-up prior, and are you maybe adding in a cooling down after? So those are some things that we can start to think about when we're going back to repertoire. So vocal performance can be really tough after an injury because there's a lot of pressure and there's maybe some anxiety that shows up for singers. And so there's a couple things that we can suggest here. There are many performance anxiety techniques out there, but my favorite is Dr. Noah Kajiyama's website, bulletproofmusician.com. And he works with many musicians and singers that have dealt with performance anxiety. And I think it's a really great website with some good resources and some blogs. One of the things that has helped singers is visualization. So taking some time to not only rehearse, but actually visualizing what it would be like to go back out on that stage. And it's sort of like positive reinforcement, like things might go well, things are going to go well, rather than thinking about, well, what could go wrong? Thinking about, well, this is actually how I visualized it. And meditation can be helpful. It's important to have a pre-performance routine, so that can include your vocal warm-up, but things like exercise or even some yoga and meditation before you actually go to the venue can really help get you centered so that you can work with the nerves, not just try to forget about the nerves. And you also want to include support from your team. You know, it's hard to do this alone. So really reach out to other singers and people on your team that can help support you as you move towards performing again. There is a stigma associated with vocal injury, and you know, it's sometimes it's hard for singers to talk openly about this because there's a lot of fear around getting fired or not hired again. Something like 30 to 35% of singers will experience a vocal injury in their career at some point. There's a lot of self-blame, and self-esteem can be really affected. So one of the things is lack of support or guidance. So again, it's really essential to have that team to help rebuild that confidence. One of the things I wanted to talk about was the fact that vocal injuries are almost always multifactorial, meaning it's not just about, well, you had bad vocal technique. Sometimes it is a gruesome schedule. It is a combination of using their speaking voice incorrectly throughout the day. I mean, if you look at the average touring singer, they've got meet and greets, they've got meetings with their business associates and managers and labels. They've got interviews, and then they got to go on stage and sing for 2 hours. So there's a lot of demands on the instrument. Yes, sometimes their technique needs to be improved, but I don't think we can just blame technique. I think it's definitely a combination of many things that usually manifests into an injury. Am I right about that, Sherri?
Yeah, absolutely. And I think that's one thing that we do as a team too, is help people identify maybe some things that they hadn't thought about that might have helped things snowball into some voice changes. Just so important to know your instrument, to know your body, and to have learn and how to have that awareness of when things change and when maybe you need to take a second and increase your voice exercises, or say no to something even, so that you can have a rest. But that is one of the things that we really try to help people with, is identify how did I get here? How did I get to the point where this is now interfering with my life? And work on some strategies directly with the voice, but also some other strategies to continue to be successful.
Mm-hmm. And here are some resources. Sherri and I put these together, and I think that it might be worth it for you guys to take a picture if you don't already know these fantastic people on this list. Voice Science Works is a fantastic website which includes things, obviously voice science, but vocal health. It even has exercises on there. And so I think and they've actually been featured on John Henney's Intelligent Vocalist podcast recently. So two of my favorite podcasts, The Naked Vocalist and Intelligent Vocalist, are on that list. I would also like to point out Dr. Reena Gupta's book, which is called Straight Talk with Dr. Reena Gupta. It's free on Kindle and also on iBooks. And it includes, voice disorders. It includes how to keep your voice healthy. It even talks about smoking in that book. And I think it's a great one. It has the latest info on it. So, and then we've got a couple books there. We've got The Balanced Singer, Bulletproof Musician, and then the integratedphysio.com, which is a local massage therapy. Integrative physio.com they're local, right?
Yep.
Yeah. Yeah.
New Westminster and Vancouver. I think there's 2 offices.
And if you're not from the Vancouver area, there's probably people in your city that do specialize in that, but you might need to ask around. Not everybody does laryngeal massage, and I think it's important to find people who have that background in it.
Yeah, and I think that's a really good point. Speech pathologists with clinical experience in voice are often trained in laryngeal massage, but again, the whole body is the instrument, so you might need a little bit more than laryngeal massage from your speech pathologist, but it is a good and important part of rehabilitation, certainly is some laryngeal massage. And to your point, Alida, also of, make sure you need to perhaps interview your team members, your singing teacher, your vocal coach, your speech language pathologist, your ear, nose, and throat physician. You might, just interview how many singers have they worked with, try to get an understanding of their philosophy, where do their expertise lie, because we want to have you with the right people so that you can make quick progress through injury and get back to a voice that you're comfortable with and confident in, and that also includes confidence in your team members.
Absolutely. And I just wanted to say that sometimes when a singer's been diagnosed with a vocal injury, they automatically think their career is over. And so we want to provide reassurance in that that's not necessarily what it means. In some extreme cases, maybe that's been the case. But in most cases, am I right, Sherri, that there is benign lesions are usually benign and treatable and,
perfectly manageable, from where I sit often as a speech-language pathologist, our best outcomes are good voice in the presence of lesions. We all know that people want their lesions to go away, and we want your lesions to go away as well. But if you can get back to full voice and confidence in the presence of a lesion, like my friend, the drummer, and I've got, we both have several people out and about making money who are managing their lesions, but they've got full voice and full confidence in their voice. That's one of the most important things we can do. So we definitely hope that you who are watching the webinar can feel, one, that a vocal injury is not the end of the world. It's nothing to be ashamed of, but it is absolutely something to address as early as you can.
Fantastic. So I've just, on our last slide here, again, we've got some contact information. If you do have any questions on anything we've presented today, please feel free to reach out to either of us, and we'd be happy to provide you with any resources, even if you're outside the Vancouver area. And thank you so much for joining us today. And thank you, Sherri, for having us.
Yeah,
and
thank you for all your knowledge and support of our performers.
Fantastic. So